The application of PRP is really broad. So we're using Platelet Rich Plasma to help men and women restore sexual function. As we age and our tissue potential decreases, the receptors degenerate, the tissue just is not quite as responsive, we have changes in sexual function, whether it's due to hormone deprivation or just out of balanced hormones or environmental toxicity. There's all kinds of reasons why the mechanism just is not working as efficiently as it was before. And platelet-rich plasma seems to stimulate a regeneration that re-engages that tissue potential. For instance, with women, we increase vaginal lubrication very easy using platelet-rich plasma. There's an increase in sensitivity that occurs due to a neuroangiogenesis. There's true tissue change. We have a tightening of the introitus. We have just a healthier tissue. We have thickening of the vaginal mucosa. All those are good things when it comes to sexual function. For men, there's cardiovascular changes that can certainly affect erectile function, and that needs to be considered. There can be a decrease in sensitivity, especially with men who have insulin sensitivity or frank diabetes. There is just changes in the ability for the tissue to respond to medication, for instance. A lot of men will use successfully the PDE5 inhibitors such as Cialis, Viagra, Levitra, and then over time, they no longer work, and that's really a degeneration of the tissue potential. And I want you to get used to this concept of regenerating potential, because that's really what we're doing here. The first time I injected a man who was a non-responder to PDE5 inhibitors where he previously had been. I injected him with platelet-rich plasma. About 6 weeks later, we had a telephone call, and he was very, very excited that he now had great sexual function. And really what it was is the tissue was regenerated to the extent that now his Viagra or Cialis or Levitra was working again. Now that's a big deal. So that's what I mean about regenerating tissue potential. So we use platelet-rich plasma to regrow hair. We're stimulating stem cells wherever we put the platelet-rich plasma. So it makes perfect sense that you can stimulate a follicle to grow. There, of course, has to be a follicle there, which in most cases, when you intervene in someone who has a complaint of hair loss and is trying to really reverse that process, there is a viable follicle that is easily stimulated with platelet-rich plasma. You get improvement in the actual scalp as well. You get, again, an angiogenesis, so new blood flow to the very fragile follicle. It makes perfect sense. When you look at the market for these procedures, it's huge. 50% of men and women actually have problems with their sexual function, so much so that they seek care from physicians. Urinary incontinence is very successfully treated with platelet-rich plasma and some of the techniques that we'll go on to show you in some of the other courses. It's just amazing when you apply this technology in the right way and you have great patient selection. So 43% of women actually have urinary incontinence. 50% of men and women have sexual dysfunction. Many, many, many men and women have hair loss. In fact, it's one of the #1 sought-after treatments. People have concerns over hair loss throughout their lives. So it's just an amazing opportunity for you to present some alternative options, some very, very effective options for your patients. We use platelet-rich plasma for aesthetics. The skin is very, very easy to change and stimulate in a regenerative way. I use PRP alone as an injectable to regenerate tissue. We use it in conjunction with microneedling to really stimulate some change in texture and to get that youthful glow. I use it with every laser procedure that I'm doing. I use it with PDO threading. I call that the studio lift. We use it for women who have lichen sclerosis, which is a very, very painful inflammatory process of the labia. I've used it for men post prostatectomy, where we can really restore some good sexual function. We've used it for men with pain with ejaculation, testicular pain, just different pain syndromes that occur. I've used it in joints to regenerate the tissue in the joints and to decrease and eliminate pain associated with joint degeneration, as well as muscles spasm and some of the chronic pain syndromes that develop. It's just unbelievable, the size of the market for these various procedures. And you can start with bringing one of these procedures to your practice and see how that goes. We can teach them all to you right away. If you have a practice that has male and female patients in it, then you have some opportunity here for sure. I hope to share all of the details of these procedures with you in later courses. You'll see that none of them are difficult. And this is just a beautiful, beautiful opportunity to change the game in your practice.